Hello, I my name is Chinedu Wadike. I'm manual osteopathic therapy student. I'm going to be a therapist today. Can I know what brings you in today?
For the past 2 weeks, I've been having this pains on my left hand side
Okay.
shoulder, as well my right side thigh.
Okay. So if I understand you vividly, you are having pain on your right shoulder and also pain on your right quads, your right thigh. Okay. So I'm gonna start assessment with you, and from there we proceed to treatment. Do I have your consent?
Yes.
Okay. What you're gonna do for me? Can you turn to your right? I want you to move that way. Go, go, go. Keep going. Keep going. Come back. Come back. Okay. Can you turn face that side? Okay. Okay. Turn to your right. Okay. Okay. Turn to your right. Okay. Face me. Okay. Can I have your face turned back? Face back me. Okay. So right now I'm going to perform a stock test. Okay. So I'm performing a stock test. So I'm going to put one of my thumb, my right thumb, on the PSIS, and the second one on the S2. Okay. So I'm going to ask you to lift your right leg up. Okay. Okay. Can you lift your left leg up? Okay, good. I want you to raise your two hands up. Okay. Can you raise your left leg up? Okay. Okay. Can you raise your right leg up? Okay. Okay. So here I'm looking for that inferior movement. Okay. I want you to lie here, head there. So I'm going to perform CCP, common compensatory pattern. So we're going to assess him. So start from upper thorax. Relax, relax, don't help me, relax. So here, I'm looking for that way of ease. Which way does he want to go? Then we'll come to the lower rib cage, lift, to the left, to the right. And here also, I'm looking for the way of ease. Then we'll come to the pelvic diaphragm. And we'll lift here. Here. Here I'm also looking for the way of ease. So the next thing I'm going to assess is the rib cage. So I'm going to grab the lower part of the rib, lower rib cage. Then I ask my client to take a breath, breathe in and out. Just keep breathing. Don't breathe too hard, just keep breathe normal. Yeah, normal breathing. Okay. Okay. So here I'm looking for that anterior lateral movement. So on the upper thorax, I'm going to assess. Keep breathing. Okay. And here I'm looking for that superior anterior movement. I'm going to assess between the lower rib cage and upper thoracic. Okay, keep breathing. Okay. So here I'm looking for that superior inferior movement. That's what I'm looking for. So at the CCP, if you decide you don't want to lift this way, alternatively, you can place your two hands on the upper thoracic and move, sink in, move to the left, to the right, and here you're also looking for the wear of ease. And also at the pelvic diaphragm, if you don't want to lift this way, alternatively, you can as well place your two hands on the ASIS. Then you go posterior lateral to the right, posterior lateral to the left. Yeah. So, can I have you turn? Now I'm going to perform pelvic diaphragm and sacral rock. To check the pelvic diaphragm, I will locate the ischial tuberosity, then place my hands, and I ask my client to breathe. Breathe. Okay, so here I'm looking for that symmetric movement or asymmetric movement. So here, sacral rock, I place my hands on the sacrum. Then I ask my client, can you take a deep breath and release? Breathe in and out, breathe in and out. Okay, so here I am looking for that notation, counter notation movement. That's what I'm looking for here. Okay, I'm going to start my treatment. Can you face up? So he has shoulder pain and quad discomfort. So I'm going to start by treating the right quad. So I'm going to start by palpating. I'll use palpation to see the texture, the tone of the muscle and the temperature as well. So you can use palpation. You can also palpate here. Okay. Okay. To start with my treatment, I'm going to start with strain around the clock. Place my hand. Relax my hand. Stack. Sink in. Then I look for that wear of ease. I move superiorly, inferiorly. Which way does it want to go? Okay, you want to go superiorly. Okay, so I hold it. So treating the wear of ease is called treating indirect. So now I'm treating indirect because it wants to go superiorly. So we start, we hold it there, and we wait for the tissue to unwind or to say, hey, move. Okay, let's go back, let's go inferiorly. Okay, so if I want to go clockwise, so I move superior, then I move medial, then lateral. So if I want to go lateral, so what I do, I move inferior, lateral, then medial. So I rock. So okay, it wants to stay here. So we can stay here as long as the tissue is welcoming our hand until tissue begin to unwind. That's what we are going to do. Okay. So treating the quad, I can do cross hand, abdomen and quad separation. So I place my hand on the quad, then I cross this one to the abdomen. So what I'll be doing is my two hands will be separating from each other. So this one is going, my right hand will be going superiorly, while the left one goes inferiorly. So what I'm doing is I am separating my two hands. This one is going superior, this one is going inferior. So by so doing, we are stretching the quad. Alternatively, I can decide to place my two hands on the quad, stack and sink in, and wait for the tissue to unwind. He also says he has pen on the adductors, so I can also separate the vastus medialis from the rectus femoris. I can hold this and pull. Or I can also find the sartorius. I find sartorius. Then I separate the sartorius. I look for the sartorius and semi-tendinosis or semi-membranosis. Try to separate the two. So I lift. Okay. So on the shoulders, I can place my hand on the shoulder and wait for tissue to unwind. Okay. So the next thing I'm going to do is I'm going to try to decompress I'm going to do sacral decompression. So I'm going to put my hands. With my hands. I put my hand on the S1, between S1 and L5. So what I will do is I'm going to pull. I will pull caudal or inferiorly. So what I'm doing is I'm decompressing sacrum and lumbar, sacral lumbar decompression. Okay, so my hand is this way, in between L5 and S1. So I'm pulling down. So to come out the same way, it went in. After that, I can do left hand. Left hand on the sacrum, this one, on the atlanto occipital bone, OA joint. So what I'm doing is this right hand is going superiorly and the left hand is pulling inferiorly. Okay. So after that, I'm going to explain to my client. From my assessment, I discovered that from my palpation, you have tight cord. It's tight because it's tight. So I also discovered that you have a SI joint syndrome. So that is why it's pulling. That's why you're having that pain there, because it's malaligned. You have a sacral malalignment. Okay, so that's why you're having that there. And sometimes overuse too can cause that. Stress can also cause that one. So, and the shoulder, from my assessment, I noticed that you have elevated right ear. You also have elevated right shoulder. So since you have elevated right shoulder, it will be pulling on the pec minor here. So it's pulling on your pec. The pec is on the coracoid process and rib 2, 3, and 4. So it's pulling. So when it's pulling there, so pec is going to get tight, and the upper traps too is pulling up. So, and the rest of the shoulder stabilizers, the 6 muscles too. I found out you have hypertonicity too on your upper traps. So, and I think also because of your work, the kind of work you do heavy lifting things too. So, DOMS, like delayed onset muscle syndrome too, it has accumulated there. So it's causing also the discomfort that you have there. Okay, so you will be doing some stretches. So the stretches to is that one. So I think that will be all for today. Thank you for coming.